Hi, I'm Chanel. Yesterday, NHS England revealed it's seen a 252% increase in hay fever sufferers looking for advice on its website. But what about the people on the Isle of Man? I spoke to Clear Pharmacy Manager Hamza Abdul Ghani.
The hay fever numbers that we've seen in our pharmacy have gone up considerably. Yeah, so all types as well. So you've got grass pollen, dust mites, different types of ragweed pollen is quite common here on the island, and it's present all year round, but it excels quite a lot during this season.
Any idea why we're seeing that increase now? Has it been like this in the previous years?
I think hay fever has always been around, obviously. We are noticing over the last few years that there's been a steady increase in the amount of people that are suffering with hay fever. The theory behind why it's increasing is because we're being cleaner and cleaner. And if we look at the COVID years, everybody was very was trying to be as clean as possible. So like washing their hands more regularly, cleaning surfaces more regularly as a part of the COVID guidelines. And what it does is it gets rid of a lot of things that normally the body would use to learn from and to build antibodies and to build a reaction to. Now, obviously, because we've been cleaner, there's less of this happening. So now that our bodies are less used to it, we're seeing more symptoms arise from it.
What are the symptoms?
So it depends from person to person. So some people will have we're getting a lot of people that are coming in with itchy eyes. That's quite a common one. It's watering eyes as well. You have people that have nasal issues as well, so like stuffiness, blocked nose, itching all around the body can also be something that some people present with. There's a multitude of things. Some people can get like some swelling around the eyes as well, and like puffiness to the face as well with hay fever. Some people cough as well. That can happen. You can get some irritation. So they present differently in different people, but we're seeing a big range of different symptoms.
And how can it be treated, or what advice are you guys giving to people that's coming into the pharmacy?
So we like to treat people on an individual basis. There isn't necessarily a one-hit wonder. So if somebody comes in with just watery eyes or itchy eyes, we'd rather give them something just to tackle that symptom specifically. But if they're coming in with multiple issues, then we would rather give them, for example, like an oral antihistamine tablet. One thing that has been released over the counter for sale over the counter was previously a prescription only drug in the UK and in the Isle of Man is fexofenadine, which is it's a fairly new antihistamine drug which is non-drowsy, and it's just been released for sale over the counter. So if you go into your local pharmacy and ask for fexofenadine, 120 milligrams, that is probably the gold standard in terms of like tablet antihistamine. But like I said, there's no point going on a tablet unless you're having like a range of symptoms. Otherwise, you'd rather just tackle them individually. So if you've got like a nasal drip or like congestion, you could just use a nasal spray so that we keep it localized in that area, unless it's a systemic thing where it's affecting a few parts of your body. So say you're getting like skin itching as well as eye wateringness, then you could take a tablet for that. But we like to treat it from case to case.
I've read that with summer we get higher pollen counts. Is that also impacting, or is that one of the reasons why we see so many people suffering?
100%. So, like you said, there's more pollen count. Obviously, it's the season for everything growing, and they produce more pollen, and you end up with just a higher rate of things that trigger your histamine response, and that's something you can't get around of really. Some people suffer more during the summer, and some people suffer more during the winter. It's not necessarily for everybody that suffers more in the summer than winter. It just depends what your body's sensitive to. So everybody's body is different, and some people are sensitive to certain things that are produced more in in the summer, and some people are sensitive to more things that are produced more in the winter. But overall, we can say that there's more pollen in the summer, and that's why we have more people that come in for treatment in the summer.
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.